as we continue to explain how diaphragm pacing works and how it can impact someone's life. You're now going to meet Monique Ponce and her 2 children. Monique was diagnosed with congenital central hypoventilation syndrome, or CCHS, when she was a baby.
I was like 14 months old. I got a cold and it was pneumonia, and they didn't know what it was, so they took me to the hospital, and I stayed in the hospital for 6 months, and during that time is when they diagnosed me, and so I had my pacers implanted when I was 14 months old, one side, and then when I was 18 months old, the other side. I had a sister that's 2 years older and a sister that's 2 years younger, and they don't have any medical issues at all, so I was raised just like my sisters were. I played softball from like 5 years old, Little League, I guess, all the way through high school. And, you know, I would go to the beach and swimming and little water parks and Disneyland and all, like, everywhere that, you know, kids go. I would go to sleepovers. I went on, like, backpacking trips with my church, and I just brought my machine with me. And I just always knew that I couldn't fall asleep without it, so I kind of trained myself to be able to tell when I would get tired and then just hook up to my machine. I never really thought any differently until I had my kids, and they have their medical stuff, and then I did the trachs and ventilators, and then like my daughter got her pacers put in, and so I had to actually like I weaned her off of the vent myself and started using the pacers, and it took like a year, you know, total, from like when she got them to when we were using them and got the trach out. And then now I'm doing it for Diego too, because I'm scheduling his surgery for next year for his pacers. I don't know, for me, it's just like life, like that's just how it is. And who better to teach my kids about it than me? And that's why, I don't know, that's why I feel so confident with it. And I like the fact that I've been able to like network with other people and kind of help them out learning to use the pacers and stuff, so it's pretty awesome. I ordered these medic alert bracelets, which are awesome because I just think that I need to be like extra cautious, because if there's ever, like I did it because if I'm ever in a car accident or something and like say I'm knocked unconscious or something, then you know nobody would know by looking at me that I have this major medical thing. And so there's a sticker on my window, and then their dad also has a sticker for his window because I have the bracelets for them also. Let's see, breathing pacemaker, no MRI, ventilator dependent while sleeping. And then it has the number, and then they have my paperwork from the doctor, so if I'm in an accident, they call the number and give them my little file number, and they have my whole medical history. One thing I want to make sure that people know, and that you're very adamant about this, that all the parents and you know the patients themselves get as much knowledge and know like the limits, medically speaking, like what the CO2 should be, what the oxygen should be, and every time we go into a hospital setting, you have to reiterate it over and over and over again, because you know some doctors don't know what it is. A lot of people don't know what it is. I guess advice for other parents I would give them, just like to kind of take it one day at a time, and you know everything's going to be all right. And the simple fact that I've kind of grown up and I feel like I've had a pretty normal life, but you know now that I'm like reflecting back on it, since I'm 31 now and I'm like looking back on my whole life, it's been a lot. It's been a lot that I've gone through, but you know it's just like I don't think God ever gives you more than you can handle.
In our next chapter, an experienced mom offers some troubleshooting tips.